First of all, thank you everybody for attending, and feel free to compliment John and the staff here. This is a Class A venue they put us up in. I'm very impressed, and I appreciate that he does this as a way of giving back to healthcare professionals. That I know early in my career it was hard coming up with money to go to conferences, and they make it it's a lot cheaper than Amy. So. So anyways, what I wanted to start today out with is I want to find out a little demographics of you guys. How many of you are pure biomeds? Got one. How many imaging? How many combo, imaging and biomed? Pretty much the rest of the group. How many ITs? Well, the reason why I asked this is what I have 3 lives essentially. I started as a biomed, switched to, got my computer engineering degree. So I did a lot of IT stuff, and then currently now I am a manager of medical imaging services at Wellstar. So I've kind of, in the technical world, I've hit all 3 lives. So that's why I like seeing who's out there, so I can kind of like questions and answers, or I can tailor some of the comments in my slides to what you guys may really need. So we have some questions and answers at the back of this. So anyways, a little bit about us. Let's see. Get my clicker right. A little bit about Wellstar quickly. We're now up to 13 hospitals. I started with 11, went to 9, went back, woke up one morning, and they said, congratulations, you're back up to 13 again. So we're one of the second busiest emergency rooms in Georgia, one of the largest healthcare providers. A little bit of history of me, so you can look back at these slides and get them online. Where'd he come from? There was a joke that they thought there was 2 of me, because I kept sliding up and down I-75. And I do have an older brother with the last name of Gall, who is a biomed, who retired a while back. So I'm kind of the alter ego of him. He wouldn't get in front of 5 people to talk, and that's family. So one of the thoughts I want to bring to you guys, and this really rains out not only to this presentation, but anything you do in the hospital, if you can't explain it simply, you don't understand it well enough. And this actually came from, the thought of this came from a nurse I was working with at Erlanger, the hospital I was in. I was sitting during a project, meeting, writing down my notes, and she said to me one day, she kind of tapped me on the arm and said, "Do you realize why everybody sits on your right side?" And I said, "No." And she said, "We read your notes because like IT would be running the project," and she said, "I can't understand a damn thing he says." And like, I would translate she said, "You can talk geek. We can't talk geek, and you translate." So when you're talking to people, and I've coached a lot of technicians, talk at a level the person can understand, because it's real easy. We're a smart group of people. Unfortunately, we have to make sure we communicate good. This is one of my favorite slides right here. It says it all about communication. So I'll give you a minute to read it. First slide, this is what the person wanted. This is, as you're reading through, the last slide in a nutshell is what the person wanted. But when you keep going through steps, this is what it turns into. Anybody had this experience in life? More than I want to remember, unfortunately. And so what I'm going to do right now is this topic can go on for like a half a day class. So I'm just going to give you kind of like the little salad plate to get you guys going back home and saying, hey, I want to do this. Because kind of what got me started in projects was I ran one of the biggest projects in the country, installing all the monitors at the University of Michigan. And I realized we were doing a great job. And then somewhere down the line, I realized that when I switched to Erlanger, there is actual process for doing this. We don't wing it. Unfortunately, fortunately, we were very good at what we did, but we weren't really following what we should be doing. So this is something I want you guys to think about. It's not the successes, it's the failures. So project management statistics, 9.9% of every dollar squandered is basically squandered due to poor project performance. projects go over budget 27% of the time. How many people have to go out and ask for more? You ever gone out and asked for more money? That's one of the most humbling experiences in our career. 17% of IT projects go so badly they threaten the very existence of the company. 73% of respondents, these are, stats you can look up, but, basically, so the projects are either always or usually doomed right from the start. Anybody walk into a meeting and hear something and go, we're doomed? I hate to say it, but many times it's, sometimes you're trying to snatch victory from the jaws of defeat. And sometimes you can't do it. IT failure rates are between 5 and 15%, representing $50 billion to $150 billion a year. So what we do when we're working on these has a real impact on the bottom line of our businesses. And I don't know about most of you, but every hospital I've ever worked in is 90% of the time they're strapped for cash. Doesn't matter who they are. So I want to talk about here a little bit is the phases of project management. And this is where I found out, hey, there's stuff that you're supposed to be doing. These are universal definitions. Won't go over them in detail right now, but these are basically the 5 steps of project management. And one of the things that the project life cycle is when you're talking about that, the phase of project passes through from initiation to the final closure. Everything has to have an end. If you are in something and you haven't determined that there is going to be a completion somewhere, you are basically doomed, because there will never be basically a happy outcome for somebody. Stakeholders, any person affecting the outcome of a project. So there are many definitions for a stakeholder, but basically anybody who has an activity as a result of the project. How long, if any of you done physician acquisitions? Probably one of the biggest eye-opening things I ever learned was we would go out and our job was to do the technical side of stuff. If you're a biomed imaging person or something like that, you know the time frames of what it takes to install equipment, you know how it takes to, basically our stuff's pretty cut and dry. In the world of IT, when you're starting to do some of the stuff, a build for some, let's say medical billing, may take 6 months. So you may be flying at 4 weeks and nothing's going to happen until you've reached out, you know who the stakeholders are and what their expectation is. Sponsor, who we're mentioning about that with the money, who provides the resources and support for a project. And that's also another thing that will get you either a hero or a goat. If you can figure out a way to save your sponsor money, great. If you don't know how, if something goes wrong, that's probably the person that's going to be talking to you. And in one of my lives, we were a county hospital. We had to answer to our board, which is the state of Tennessee, the city of Chattanooga, and the county of Hamilton County, plus our board of directors. And there was a rule that you never, ever walk back to them and ask for $1. Because you literally, you heard the analogy of the dog walking back with the tail between its legs. Never ask, like if it was even $1. Make sure you got it right, one and done. Because in that old world, that was their sponsor. That's who my money people were. This was a unique individual that actually the first one I worked with was a great person, Gail Rowe, out of the University of Michigan, and she taught me a lot. But the project manager and the project team, basically a project manager is the person who orchestrates you all. If you're doing, and we'll talk a little bit about staying in your lane and things like that. But the group of a project team, some of my meetings we have, I think with the physician acquisitions we're doing right now, we have 35 to 40 people on each meeting. And literally we go through block by block by block by block by block. And the most important thing you can do to support something, a project manager, if you're on that list, even if you're sitting listening to 40 other people, when they call your name, make sure you're there to say, I'm here. No comment, got this. Most project teams are only 5 or 6 members, but lately the ones I've been working on, it's 40 people. And think about that. If you put a dollar figure, I just use $100. Each person's worth $100 an hour. 40 times 100, that's a lot of money sitting on that meeting. And that's why I'm always respectful of people's time. Project scope, this is always fun. We'll talk, the work to be done to deliver a product or a service. This is what's supposed to happen. You start at A, you end at B. That's in theory. Some of the things into scope of a project: money, tools, people. The most important resource I've learned in my whole career is people. Materials, data, and another one is relationships. One of the things that have been one of my strengths in my career is I've had those different lives where I've worked with the clinical people, and part of the trust you build with people is how they perceive you. Like maybe sometime earlier in your career, you're a BMET2, you're a BMET3, how you handled yourself in ICU or something, or in a low-level meeting. That nurse that you helped out, one comment I want to make is I remember one of the nurses I worked with many, many years ago early in my career, had a great relationship, helped them out. Lo and behold, 10 years later, guess who became the CNO? So when you had problems, like when if somebody looked at your department to outsource it, first answer was, I didn't have to say a word. I had somebody up above us that was watching us. Human resources, internal staffing, external staffing, vendor resources. Especially with vendors, everybody's lean. Over this time that I've been teaching this, everything's been getting leaner and leaner and leaner. How many of you have job openings right now? Job openings. Yeah. The unfortunate part of, so internal staffing, right now, a lot of our demographics, people are saying, I'm 60 years old now, and I'm still the kid in my department, which is like, if you put that in perspective, going like, there's a warning bell that should be going off here when I'm 6 months younger than my, my next technician. And also vendors will try to get you to do everything that they can't. So relationships, expectations, vendor communications, I always have a rule of, how I engage a vendor, how they communicate. Some of the things that I'll do is define, like if you're doing something with multi-vendors, some of the projects that I have run, like we're doing equipment evaluations, you make sure that everybody has the same set of rules, and you hate to say it, but you're like a parent, and you say, you will not do this until this time. Or if you want something special, you make sure that you're always consistent with people. The external, how do you interact? Make sure everybody understands. Like as far as a project goes, I've had several discussions with people where I've said, if you mention something, especially during evaluations, if you mention something that's not on a bid or something like that, and the form comes back to me, I will tear it up in front of your face and throw it in the garbage. And I did that many years ago at the University of Michigan. I tore up like 20 evaluation forms because they brought in something that was illegal. To show to the staff, they said, look, they all love this. And I said, but we're not buying that. So income and inspection, initial inventory, who does that? Years ago, we actually used to unload the semis at Erlanger. And there's a good story on why this happened. Years before I got there, they counted out a bunch of pallets for a patient monitoring system, which was great. They're on the truck. But unfortunately, they counted them on the truck, not on the dock. 2 pallets stayed on the truck. And then somewhere down the road, months later, somebody went, where are this was before I was there, where are all the CPUs? Where are all the central stations? It was signed for. So hospital's liable. Lo and behold, 6 months later, they found the truck. This is Chattanooga, Tennessee, we started in. On the West Coast, somewhere in Washington or Oregon, that same semi-trailer still had the same 2 pallets on the very front of it. So one of the things is making sure you have everything you agreed to. Timelines. Timelines are used to set a base schedule for all the team members to follow. Any of you have time management problems? I still do all the time, you know, but I keep getting better and better. I think I've been in this career. It was actually, I lied. I said I was 40 years in the last presentation. I'm 39. But if you consider the first service call I went on, I was 17 years old with my older brother. So I was actually 1978 in advanced electronics. And my choice was either I help him on the service call in the linear accelerator or we don't go water skiing. So what would you pick? I'm going water skiing. Project management software. This is some of the most important thing. This is Microsoft Projects, great. You have to make sure everybody has the same software. Or whatever you're using, make sure everybody understands what you're doing. So Excel's another good option if you can't afford it. Use Excel. Team member tracking of projects. Establish a process for all internal and external members to track project progress. You know, Microsoft Teams is great because, like I said, we have those 40 people now. You can't keep track of 40 people. And especially when you have every other day, there's another project and it's another different potential 40 people. This makes it nice and easy where you can look back at something and say, hey, you know, where am I on that timeline? Who responded, who didn't respond? And that's your alarm bell that should go off. If you don't see a name that's checked off as an attendee and you need something from them, this is invaluable. And this is a big one at the bottom. I kind of mentioned this before. Make sure everybody, when you go in anything on a project, I'm gonna pick on anybody, you're my facilities director. If I walk into a project and I don't see you're there, conversely, when I'm talking about those relationships, somebody will go, hey, wait a minute, we're missing somebody. This will get you into more trouble because all of a sudden, oh, I picked Fred Smith, not Fred A. Smith. And so some guy, Fred Smith, that's in accounting goes like, I don't know why these goofballs keep inviting me to this meeting. I just, you know, I ignore it. It's like risk analysis. This is, I've had all over the spectrum. Any of your hospitals, risk is basically how much appetite your hospital has for stuff. I've been everything from high risk, medium risk to the current climate I'm in is basically they're risk adverse. They are, and I realized that pretty quickly when I got there. So everything I learned at my high risk hospital, I said, not even gonna run this as an option. So an event or condition that can happen that can have a positive or negative effect on one or more project objectives. Define risks associated with the project. There's some things in here you can go out and look on. Like I said, these slides are online. How much risk can an organization stand? And there's no such thing as no risk in life. Just like when you get in your car in the morning, there's a risk every time you go through a stoplight or you're driving down the road that the person next to you is texting. So life and projects are full of risk. Importance of meeting notes. Document progress, document assignments, documentation of changes, clarification of understanding. Save every pertinent email. And also never do a hallway conversation. If you have a conversation with somebody and they especially agree to something, make sure you immediately go back to your office and say, hey, just following up with you. on this agreement. And what's funny is even in healthcare, I have a son-in-law who's a engineer in Germany for Porsche, or basically a subsidiary company. And one of the things that he does, everything you hear on our documentation, emails, and he's a lot better than me. He's Germans, Italians, Americans. Most difficult ones are Americans, but how do you document and how do you track things? Because when things go wrong, you have to go backwards sometimes, or agreements or something, you have to go backwards, and there's nothing better than documenting everything. Critical path, a sequence of activities that define the longest path through a project. Anything that affects your critical path can derail you. Scope creep. Remember I mentioned that key thing, scope? There's this other component called creep. And if you think of that picture of the swing when we started this, the person, all they wanted was a tire swing. Somebody else got involved in all those phases, and then ultimately at the end, the person said, all I wanted was this. Uncontrolled expansion. Trying to think of many examples of this, but you start with something as simple as, I'm going to buy a new system for ROR. I picked up my Slurpee machine years ago. We had a prostate machine that was basically for cryogenics. So now this requires special, it's great. I bought the machine. The doctor had to have it. They recruited the doctor, but all the infrastructure that was required for this machine creeps a project out, whether it's equipment or whether it's building. You'll see later on some of the examples of I'll talk about another fun scope creep. But this will tie up the resources such as team members. And the last thing you want to do is tie up your team. And final timelines, most of the time you can't make it. 50% of all projects have scope creep. Most of the ones that I've been in, it's a lot higher than that. Change, and this happens all the time. I made that joke. Started with 11 hospitals, came in one morning. My director said, guess what, we're shutting down one hospital. A few months later, keep going, make sure that other hospital, level 1 trauma center supported, no problem, hustling. Find out later we can't afford to have it open. By the way, we're closing that other hospital down in 30 days. And first thing he goes, what? All that work we did, setting up this new place, now we're shuttering it. Then as we finished that, guess what? One morning I woke up, news, congratulations, we're getting 4 more hospitals. And if you're in the state of Georgia, you probably have heard all about Wellstar and Atlanta Medical Center, Augusta Medical Center. So we went from being the villain of Georgia to the savior of Augusta. So so you take that with a grain of salt in this profession. But scope change, that's cost time, let's see, corresponding crashing and fast tracking. Compression, what everybody needs, you'll be asked a lot of times, it takes X amount of weeks to get equipment. Can you make it faster? Decreasing the overall timeline to complete. Crashing technique used to shorten the schedule, duration of the least incremental by adding resources, fast tracking. Sometimes in life you can move things faster along. Dysfunctional. Anybody been in a dysfunctional instance in their job? Yeah, let's be real, we all have. Success is not an option when you're dysfunctional. Acceptance criteria, one of the things I learned early in my career was we control, depending on who you work for, sometimes you control X amount of money at the end of a project. And if you don't have people who meet, there's a set of conditions that whenever your project sponsor, your purchasing department, whatever, set that criteria, your project, your overall project management for your site, at the final sign off, usually they'll get their money. And the importance of this, this can also, if you do not stick with that, that can also come back to haunt you. And a good example we had of this was a project called RHP, Replacement Hospital Project at the University of Michigan. We had acceptance criteria for all sorts of stuff. Our biggest one was the nurse call system. One item in it was everything be modular. When we looked inside the head wall, everything was wire crimped. So that meant anytime you broke any part of the nurse call system, you had to hand crimp it. So that was one of our acceptance criteria that we controlled, like, I think it was 20 or 30% of the money. The biomeds controlled that. If we don't agree with it, you don't get your money. So we were at the February 14th in 1986. We opened the hospital. Lo and behold, we had all sorts of punchlines. I even had one for one of mine was sleep lab cameras. Nobody put in the specs. They had to work in the dark. But they got a free pass because the cameras didn't work, but whoever was didn't specify it. So they had to pay extra buying the cameras. But that nurse call system was in, and we estimated tens of thousands of dollars to remediate this. What happened years later was somebody took a pen and said, I forgive all of my vendors at the University of Michigan at the director level. And our reply was, oh crap. Fast forward from 1986 to the late 1990s, our biomed engineering department, who I was part of, we bid the process of completely modularizing our nurse call system on one of the biggest patient towers in the state of Michigan. So we spent hundreds of hours of overtime, but we were still cheaper than any vendor, and we did it all ourselves. But all that money never needed to be spent. And just imagine every year, if you're in the service profession, every time a head wall broke, you had to sit there and do 30 connectors by hand. And you ran back in your head, if we'd have stuck to this acceptance criteria, this 2 hour, we got to the point of we could change head walls in half an hour. I could change receptacles in 5 minutes, 10 minutes. But 24 hours a day, 7 days a week, biomeds doing that for years. But that's where that comes back to bite you. Planning and installation, clear understanding of the project scope, defining the timeline. When does this have to be done? Push people to say, when are you trying to get this here? You know, PM and project team identified. Who do you need? Clear to define who does what in a process. This is a big deal. Routine update of times or update times is scheduled. Clearly defining, you know, sometimes it's not what you see in a project that bothers you, it's what's missing. And many times, like, you know, go back to my biomed days, who makes the interface to hook the ICU monitors to the balloon pump? I remember this was an easy one. The vendor did not do it. Nobody caught on that you had to make all this stuff, build all the cables, go out to McGuire, get everything. And you, being the biomed department, had to build these. And it's not one, it's like 50. So clarify who does what, because that was the first thing. You know, start pointing fingers. Sometimes that one was completely somehow graciously missed until we'll go live. Ways to build a project. We start date is somewhere in the future, potentially years. You know, short term, one of the best examples I had on a long-term project, we used to get calls. I call it my Friday horror call. I get a call from our project management team at Erlanger and say, guess what? We decided to build, actually this was a Wednesday afternoon. We decided to build an emergency room across town. I said, cool. Where's the blueprint? We don't have a blueprint. Well, how do you go to our main emergency room, duplicate that, give me a budget, you know, 20 miles away. And the first thing that runs to your mind, you're nuts. When do I have to have this? You have to have it by close of business Friday. So fortunately, when we're talking about a long-term, what's the timeline? Where we got the CON? How long is the CON, certificate of need? How long is it good for? 5 years. And the next thing that goes through your mind is, did you just say 5 years? So anyways, one of my lucky ones was that long-term project. I submitted my budget. They came back 3 years later and said, guess what? We just pulled out your budget. I've almost totally forgotten about this thing. And they said, so I went back over it again, said, okay, well, good to go. I had done everything, what they had said, done it at list price. So when I came in, I was still like, I think 7% under budget. Everybody else had done it, their budget's at cost of the moment. And so that's one of those things, long term, how long is it going to be? The value of a dollar is not the same, especially now if you buy groceries, things like that. It's not what it was a couple years ago. Budgeting factors, predefined budget. That's another fun one. As a scope and determine that emergency room. Go build the duplicate over here. Did you add everything you needed to the budget? Look for what's missing. Vendors in the bid process, installation, new area, existing areas. One of the biggest problems you have is, depending on what the age of your structures are, I keep picking on Erlanger, so I love those guys, but one of our buildings was called the 38 Tower, and I'll give you one guess on why it was called the 38 Tower. It's okay, I'll answer that. It was built in 1938. Guess what kind of computers we had in 1938? So, that was interesting. Anytime we worked in that building, it was interesting. Installation new or existing, are you attempting to reuse anything without checking? 50% of projects, only 50% of projects finish within budget. One of the funny things about talking about that old building, we had a cath lab in it. Cath labs are pretty heavy. The building was designed to hold that. When we pulled the cath lab out and moved to this modern facility, IT said, we're going to put servers in there and computer equipment. The biggest difference, if you think about servers and computer equipment, is they're compact. A cath lab spreads out, weight over, so you see where I'm going with this, right? What somebody determined when they started to put all that equipment into that floor, they realized that basically the whole structure of the building would not support that. And basically at some point they would hit the critical point of where on the third floor that equipment would reside on the second floor. But that was because now the space was totally adequate, more than enough. But when you're dealing with some of the stuff, it's worth asking the question, is this stuff up to code? So, fortunately that didn't go in there. Just a little bit of the stuff went in, but asbestos, anybody heard of that lovely stuff? We had a whole OR area right next to where I used to work that was an asbestos OR that had been abandoned since the 1970s. Are the funds, this is the biggest thing now is I used to beat a lot of people on projects because I could pay net 30 days guaranteed. So if any of you guys were competing against me and said, I need the same equipment as Greg does, but my hospital pays net 120, I'm paying 30, so guess who's getting their equipment first? Unfortunately, that was a flash in time. That doesn't happen anymore. When I was talking about the money due on final approval, people will push you to get the money. And that's something that you have to be prepared for, because sometimes that 20% is that salesman's commission, because you paid for all the hard goods with that 80%. That $800,000 covered the hard goods. The $200,000 is his new car or her new car. Blueprint control. How many people have been given an out-of-date blueprint? How many people have been walked into an office days apart and given 2 different blueprints? At revision control, project notebooks. Back in the day, I used to keep hard notebooks I carry with me, before, because it made it a lot easier. Also, too, some of the buildings I was in, Wi-Fi didn't exist. So it's like, I'll just pull up my computer. No, that ain't happening. Shared access, we do this now, Microsoft Teams. When I was talking about those projects, all of our notes are on Microsoft Teams. The first thing our project manager does is send a notification. Remember everything we agreed to a few hours ago? It's right there. Before you volunteer, this is the biggest thing. If any of you want to do this, I've enjoyed a lot of the projects I've done. I've had the whole spectrum. I like what I do. Actually, I love being in this profession. I'll be honest. I'm one of those people that they say there's something wrong with me because I love what I do. The bandwidth in life, sometimes leading a project requires altering work hours or overtime. You have to meet vendors at all sorts of hours in the night. Sometimes you try not to do stuff like that, but if somebody says, I need access to something, communication ability, it's says it right there. You've heard it before. It's not only what you say, it's how you say it that matters. And that can take a total simple statement. Had a vendor miscommunications, all of you've had miscommunications in life. You say the sky is blue, somebody comes back to you and says, he just said there's a hurricane coming. That's not what I said. I said the sky is blue. Actually, my son flunked his kindergarten test 30 years ago because actually the sky is purple according to his kindergarten test. Any of you have a kid? Believe it or not, that was a question. I had to argue with them. It's not purple. Or no, it's nighttime. What color is the sky? Black. They said, no, it's purple. And I'm like, where'd they get that from? Internal department budgeting. How do you pay your people? Make sure who internally you want involved, who will pay for the labor of a project. One of the good things about one of my lives was we could back bill, like I said, that emergency room project. I was able to look in the crystal ball and say, I think I'm going to need this much labor money on top of the equipment. And I picked it off where everybody else didn't even consider how much money their staff was going to take to pay for this. And that's another challenge with accounting. How do you, because actually your labor is kind of built into the capitalization of the project. How soon can you start billing people? I know I've had hundreds of hours in a project that all of a sudden when the money comes available, we're back billing. It looks like the productivity in my department hit, according to Kronos, which is our timekeeping thing, all of a sudden none of their labor for weeks has gone against my own cost center. It's like, where are you guys at? Watch my timer. Okay, so we're going to start getting a little faster. Be careful before you, know exactly what's being done. Know your role. Know your boundaries of your role. Stay in your lane. It's okay to point out something you don't see, but it's not okay to take on the job. Do not take on, there we go. Do not make time promises you can't keep. Have a plan B. Something goes wrong. Hopefully you've thought that out. Common pitfalls. Let's talk about some of this. So purchasing equipment without user input. Joining late in a project and you basically, you're not proactive, you're reactive to 100% of what's out there because you're trying to figure out where did all this begin. Not taking the time to properly verify information, details, or contacts. Remember that blueprint revision thing? Or even that emergency room. What are you trying to build? Not taking the time for measurement verification. I just had one of these. I had a Dornier surgical table that came in, basically a Euro system. They found out everyone thought they measured the room correctly. They forgot, like that little corner back there that kind of juts out. That didn't exist on the blueprint they had. And they found out that that actually hit the corner of the table. So all of a sudden they went to put everything in and it was like that, oh, remember I said the oh crap moment? First thing, who read the blueprint? Facilities. And the vendor signed off. And that became I think it was like a $20,000 oops. So, what's that old saying? Measure twice, cut once, or cut twice, measure once. Yeah, whichever way you want to do it. Lack of engagement, I can tell that relationship with nurses, engage your clinical staff, making changes without proper approvals. Common pitfalls continued. Deliberately working outside your areas of responsibility. One of the things you have to realize, like with IT especially, how many people have in-house IT departments? I've had both spectrums. I had in-house, then they got outsourced. And so sometimes you can't, even though you know you can work in that area, remember I said about staying in your lane? There's nothing that will be career changing or relationship changing worse than crossing over. Unfunded equipment replacements, consignments, this is something that actually, a few times has come back. What are you trying to do? Basically, how do you get the money? Some people, consignment, we couldn't do that. Now, wound vacs, things like that, they are like a consignment type device. SCDs, quick purchases, only devices, not all the pieces. How many have had that? Somebody went out and bought the widget at the doctor's show. Interfacing non-compatible equipment. This is still relevant today. Complications, lack of research in existing structures. Did the site, remember I mentioned my different worlds? In the world of imaging equipment, did the site ever have a piece of imaging equipment? The biggest thing you learn with imaging equipment, especially some of the simple x-ray machines when you go out, there's stuff that sometimes attaches to the ceiling. And sometimes, remember I mentioned that about the, IT stuff going from the 3rd floor to the 2nd floor? Same thing, you try to mount up, you have to have the Unistrut infrastructure to put some of this stuff in. Does the ceiling have enough room above it? Who has access? Shielding is another big thing. As we keep expanding, you saw 13. I don't even know how many clinics I have in Augusta yet. I've got a general idea because I've done it. My best resource right now is a thing called Google. So as soon as I heard we were buying Augusta, the first thing I did was I started Googling, how many hospitals are you? How many clinics are you? How many imaging sites are you? So that way, at least I had an idea when the first time I got called in, it was like, oh, by the way, I'm in South Carolina now. Also conversely, we're in Alabama now, but it's not, but basically we're a Georgia hospital. We have all these outlying clinics that ring over, Augusta's separated from South Carolina by a river. And there's stuff, now we know that potentially we have to go to South Carolina. So in our shielding designs, who has all that stuff? State of South Carolina has it. When you submit anything and this is been an eye-opener for me in the imaging world, doctors' offices, and this is going back to even Erlanger, people will install x-ray systems in a doctor's office, and there's not that regular, they should be reporting them to the state, but I've run into so many systems that have been put in, and there's no shielding designs that have ever been submitted to any regulatory agency. And so you have to have that, basically the shielding is you're making sure you're not you're only radiating who you want, not who you don't want. And that can be an expensive endeavor. What's a consideration for weight of the equipment? Can't tell you how many times I want you to remember stuff like that. Weight, height. Did you get the equipment, how did you get the equipment into the building? That's become another fun part with decommissioning those 2 Atlanta medical centers. I've got 2 MRIs that people want to buy. Unfortunately, what they're offering us for money is, I'll just use an example, let's say 20 grand. Sounds good. They're old, we don't want them. One of the MRIs goes through the roof of one site. One, you have to blow the whole side of the building off. That'll cost $30,000 to get it out of the building to make 20. So you guys are engineers, do the simple math. I'm getting 20, costing me 30. I'm losing $10,000. And pardon? No, the building's so gone. The building will no longer be patient care, period. It's in downtown. No, we didn't. We're just leaving it in the building. But, I did have one of those that was actually like, how did you get the equipment out? I got a call and it was actually from it was from a doctor's office who they bought an MRI that was attached to their doctor's office at one point. The MRI had been hit by light, it had quenched. Does anybody know what a quench is? It's a real cool thing to watch. But anyways, nobody caught that this thing was dead. It was in a modular unit next to this building that was rented. It had to go bye-bye. I said, how much, they said, can you make this happen? I said, well, it's probably going to cost 5 figures, easy, to get this out. But I managed to work a deal with, and this is one of the few, with .med, where we put this unit online. It was what we call a hot MRI. So it had not been powered up forever. And we ended up selling, basically, I call it the guts of the MRI, the brains, all the cabinets, infrastructure went to Greece. The person who won it did not want the magnet. The next bidder said, I didn't want that other junk, I wanted the magnet for parts. So we managed to net, basically the long story short, we netted zero. So by the time we got the revenue from the magnet, the construction costs, they were extremely happy because if we'd have just done it, getting rid of it, it's probably $25,000, $30,000. Or if we got out of that lease, it became a 911, get this thing out of this building now, or you owe me X amount of penalties for each month it's still here. 5 ways to get it done right or wrong. Scopeless is hopeless. If you don't, decide what you're doing, just don't throw money at the problem. Focus on time, focus on time and cost, not quality. Get it done yesterday. Never let anyone spend money. Don't waste time checking anything, just get it done. Know the right thing to do. Don't analyze projects. Don't listen to an expert. And absolutely, above all, whatever you do, be sure to ignore the customer. So, if you ever dealt with an angry nurse, doesn't matter if it's male or female, they're all the same. So, you wouldn't launch a project if you didn't know everything. And what does anyone else know? Hang on here. Don't thank the team. This is the worst thing. If you're in the prior presentation, be grateful to your team. I'm grateful you guys all attended this. Thank you for attending. Your team, nobody will support you more than your team. And nobody will turn on you worse than a team that is not acknowledged. Don't push them hard. Don't waste time with planning. People ought to know what to do. Never assume that. Just tell the team to get it done now or else. Avoiding problems. All of our projects fail. How many people do you get the negative person who goes, as soon as they walk in the room, we failed the last time. You're going to fail again. I'm just going to sit here and tell you how many ways you're doing it wrong.